Suicidal behavior among teens and children is on the rise. It was the second leading cause of death among 10 to 19-year-olds in 2016, according to the Centers for Disease Control. Another study looked at hospital visits by kids and found that thoughts of suicide or attempts nearly tripled between 2008 and 2015.
We were a little surprised that it was nationwide.
That's Gregory Plemons, one of the authors of the study. His team looked at 31 children's hospitals nationwide and found an uptick in suicidal behavior during the month school was in session. October was the highest month for suicides. What would you say would be some of the factors that caused this uptick?
Many of the kids that we have taken care of have encountered bullying, cyberbullying, issues with social media, experienced trauma. The incidence seems to be rising greater among females, and girls are more likely to attempt, guys are more likely to complete a suicide.
Plemons says girls on average are entering puberty at a much younger age than they were 20 years ago, and puberty in itself is a risk factor for suicide and depression. Another contributing factor, social media. Girls are much more likely to use social media where cyberbullying and the pressure to be perfect can affect their mental health.
The act to try and harm oneself is a very impulsive, spur-of-the-moment act. On average, sometimes people say 5 to 10 minutes. I think it's important to get the message out to teenagers. Reducing the stigma as much as you can around asking for help, I think, is really crucial and important.
These are what some of the students said after.
One person who does exactly that is Melissa Molitor, who educates students about the warning signs of suicide and depression. She is the program director at Alyssa's Mission. The organization was named after 16-year-old Alyssa, Melissa's friend, who died by suicide her sophomore year.
Alyssa was a bright and beautiful girl. She had these amazing blue eyes, and she could make anyone laugh. She was someone who walked into a room and just immediately lit it up.
Molitor didn't see the warning signs when Alyssa exhibited them. Now she teaches kids what to look for.
How you do that is a 3-step acronym called ACT. So acknowledge the warning signs that you're seeing, let your friend know that you care about them, and tell a trusted adult. In many cases, friends will make their friends promise not to tell an adult what they shared with them about depression or suicide. And so our program really emphasizes the fact that students need to share those secrets, and it could be saving your friend's life.
The American Psychological Association lists suicide warning signs that include talking about suicide, having trouble eating or sleeping, and a preoccupation with death and dying. What would you say is a warning sign that most people don't consider?
What's so hard is that with suicide, a lot of people are silent sufferers, and they wear a mask on their face, and sometimes they're your happiest friend, your most outgoing friend, the one who you think has it all together, when really they are the ones who are struggling the very most. So what you want to look for is just some of those changes. Do they stop hanging out on the weekends like they normally do?
Alyssa's Mission began in 2006. So far, the organization has talked to 300,000 children in Illinois. Along with suicide prevention education and grief counseling, the group also provides a questionnaire that screens students for risk factors.
And it asks 2 specific questions about suicide. Have you thought seriously about killing yourself? And have you attempted suicide in the last year? And what we've seen is about 13% of students need to be followed up with after taking that screener.
For a friend who may be seeing their other friend go through suffering, what would you tell them?
I would tell that friend that they should do something right now. But one thing that they really need to remember is to not leave their friend alone if they're worried about them hurting themselves. If that friend is thinking about taking their life, that they need to stay with them, that they never want to leave that person alone until they can get an adult to come to them, or you can walk with your friend down to an adult.
Both Plemons and Molitor said we should stop calling it committing suicide because of the negative connotation of the word.
So when we say someone committed suicide, we think of the word commit as commit a crime, commit murder, commit adultery, all things that are negative.
Instead, we should use phrases like died by suicide. Both experts say that because of contagion or copycat effect, it's important for news reports to avoid going into detail about how a person took his or her life. Lastly, it's important to talk about depression and suicide and let people know that they shouldn't feel ashamed about mental health issues.
What would you say are the biggest myths?
If you talk about it, it'll put the idea in their head. Actually, the opposite is true, that if you talk to someone about suicide, if you ask them if they're thinking about taking their life, it'll let them know that you care, and it'll open up that dialogue so that you can get them the help that they need and that they deserve and that they probably want.
And if you need to talk to someone, the National Suicide Prevention Lifeline is available at 1-800-273-8255 or text HOME to the crisis text line at 741-741.